Yes, yes, you read that right. Republicans stink at healthcare. Before I go into the details of why they stink at healthcare, I want to get a couple of things up front so that everything is clarified. Number one, I'm a lifelong Republican. I have been a Republican since before I knew what a Republican actually was. Okay. Number two, most people, whether it be this subject or other subjects, they basically get their information from sources that they trust, and they just, regurgitate what they've read or saw. I actually sold health insurance for 26 years. I was in the streets with the people, dealing with the issues, dealing with the problems, trying to find solutions for 26 years. So I actually know a little bit about what I'm talking about. So the first question is, who wants to learn something today? Because this is your chance, okay? I may have voted for one Democrat in my entire life, which was for Kansas insurance commissioner, because at the time we had a Republican insurance commissioner who, from what I saw, was absolutely corrupt, in my opinion. She let a really bad group operate in the state illegally. And either I didn't vote for insurance commissioner that year when it came up, or I voted for the Democrat, either way. But I've been a Republican forever, okay? Now, we have to address these issues. It's not just the Democrats that are bad on the healthcare debate. The Republicans are actually probably worse. So I want to go into some details. For almost the entire time I was in the insurance business, 26 years, the Republicans did literally almost nothing to address the biggest problems that created Obamacare in the first place, which were basically people who didn't have access to group insurance, but for whatever reason, usually health-wise, couldn't get individual coverage, and B, people who were making too much money for Medicaid, but were still broke and couldn't afford health insurance, legitimately couldn't afford it. Republicans did almost nothing for that. During the Clinton administration, of course, Hillary tried her disaster of a deal that was so bad that they couldn't get it passed through a Democrat-controlled Congress. Yet people believed Hillary when she said she was going to fix health care here in 2016. They still believed her. Okay, her deal was a disaster. No questions asked. But during the Clinton years was a thing called the Kennedy-Kassebaum Act. Started off on the Democrat side, but then, Kennedy, and then Kassebaum came in. And the two main things I remember coming out of that was that group insurance became guaranteed issue, and there was a rate cap on the most that a group could be charged based on pre-existing conditions. That caused a little bit of problem maybe in the beginning, but you know what? It's all these years later, and the group insurance industry still exists. So it wasn't exactly like it ended the world. Okay, the worst thing in the world didn't happen. Okay, we're still alive. We're still here. Most people in the country actually have group insurance. Okay, so the Democrats at least took steps to address these problems, while the Republicans sat back on their hands, took their lobbyist money from the insurance companies, and did nothing. Okay, now we got past the Bush administration. The only thing the Bush administration did on health care, for the most part, was they created Medicare Part D, which was for senior citizens, had nothing to do with the underage 65 population. Oh, and they created Medicare Part D, but there were no provisions in there to negotiate drug prices with the drug companies. Okay? See, this is what I'm talking about. So now we have Obama. Obama gets into office. From the day Obamacare came out, I said it was never going to last. It could never last long term. As far as I'm concerned, Obamacare is an absolute sham. It was designed to be a sham. I would go as far as to call Obamacare a scam, because there's no way the people who put it together were so stupid that they thought what they put together could work long term. So I think they put together a plan that was designed to fail. But whose fault is it that Obamacare happened in the first place? No, it wasn't the Democrats. It was the Republicans. Because in the 6 years that G.W. Bush had control of Congress with the Republicans, they did nothing to fix the healthcare problems in this country. Now, did that excuse the Democrats to go as crazy as they did with Obamacare? No. But had the Republicans done more when they had the chance, we never would have had Obamacare in the first place. It's going to be gone soon. It's imploding. We already know that. So we have to move on to the next thing. The Republicans, as you know, screamed repeal and replace for 8 years. And then when it came down to it, had nothing because they're feckless and they're irresponsible and they're blowhards. And I'm telling you guys, any Republican politicians may be watching this, if you don't put something decent together, come 2018, the House is cooked, the Senate is cooked, and we're going to have President Pocahontas in 2020. Okay? Now, what's the big thing that the Republicans are talking about now? Free market solutions. You know what? Ha! Okay? Free market solutions when it comes to the health insurance industry is a joke. Why do I say that? Because I was around when free market solutions, quote unquote, were how things worked. I saw the crap, garbage health insurance plans that were all over this country. Best example I can give with these, quote unquote, these fake self-employed associations where they put these garbage plans together with limited benefits, and their agents lied to the policyholders to get the customers to get them to buy them with almost no drug benefit, almost no outpatient benefit, sometimes almost no inpatient benefit. Plans like that were all over the country. And they weren't cheaper. But agents lied to the customers and made them believe that they were good plans. Then there were plans that were otherwise decent plans but had no drug benefit that were sold by decent companies. Okay? I can't see why anybody would possibly buy a policy that has no outpatient drug benefit whatsoever in it. Now, why are they doing that? Because they feel that that's all they need. Well, you know what? If the agent was being legitimate with them, they would explain to them why having benefits like drug benefits are important in a plan. Because at least especially back in those days when there were free market solutions, if you were healthy when you bought the plan, but I'm not paying extra money for drug benefit because I don't need it, and you come down with cancer and your drug bill's $1,000 a month, you couldn't then go ahead and buy a policy that had drug benefits because now you're basically uninsurable. Okay? So Hannity, Sean Hannity, I love you to death. Been watching you since Fox News started. You need to kind of change your message if, hopefully you're getting to watch this. You change your perspective on free market solutions, okay? It doesn't solve all the problems. If the insurance companies have their way, they'll find every stinking way they can find to skirt the system, not include coverage, get out of claims, whatever the case might be. There has to be government oversight in the healthcare business. Listen, I am for small government. I'm for lesser government. Get rid of things that the government shouldn't get involved in. I could care less if the government gives a dime to the National Endowment for the Arts and stuff like that. Get rid of that stuff. But the government needs to have a place in the healthcare arena. Because if the government doesn't, the insurance companies will run wild like they did before. Now, this leads me to my next subject, and this will make Republican heads completely explode. Yes, the government does have a place in healthcare, and here's how it works. I am not talking about Medicaid, which everybody hates. I am not talking about the VA system, which clearly has problems. But good luck trying to find a senior citizen who hates Medicare. And why is that? Medicare is not single payer like Medicaid and the VA are. Medicare is like a hybrid between the government systems and private industry. Everybody has both. Medicare in itself doesn't come close to covering everything, but it does provide basic coverage for everybody. And let's face it, the fight between government and private industry will always exist until they figure out a way to actually work together. And Medicare works that way. Every single person who's got Medicare also has a Medicare supplement to cover the things that Medicare doesn't cover. Okay? It might be a standalone policy. It might be some type of fee-for-service plan, Medicare Advantage plan. Those are all written by the insurance companies. Okay? So what you do is you put everybody on basic Medicare and do the standard payroll deduction. Okay? And then everybody buys a Medicare supplement from an insurance company to cover the rest of their services. Therefore, the government gets its little hook into the system, not as much hook as they wanted, okay, but they get a little hook in the system into everybody's health care that provides the basic coverage, and then all the insurance companies can create Medicare supplements to sell to the people, which keeps all the insurance companies in the healthcare system. And actually, because of that, it absolutely will expand competition because more and more and more companies will offer Medicare supplement plans. Now, you got Medicare on the basis on everybody. And by the way, Medicare negotiates prices better than the insurance companies do with the medical providers. Absolutely. They say, if you want our policyholders, you want our people to come to you, this is what we're going to pay. Take it or leave it. Almost every doctor in the country accepts Medicare. Okay? They're also more efficient, cost efficient than the insurance companies. Again, you're never going to find a senior citizen complain, oh my God, I hate my Medicare. It doesn't happen that way. Okay? So you've got the insurance companies completely involved, all companies coming in, selling plans all over the place. Nobody in the insurance industry loses their jobs. Okay? And then you've got the basic coverage through the Medicare system. Now, people are going to go off on me on this. I know they're going to, but the difference between me and most of you is you're just regurgitating stuff that you read from sources that you believe. I actually understand what the system works, how it works, okay? Don't just tell me things like the government has no place in healthcare. If you disagree with what I'm saying, give the specific reason why. Okay? Don't give me this BS about we don't have a right to health care. Okay? Because there's nothing in the Constitution that says that we don't. Okay? The Declaration of Independence has a thing called life, liberty, and the pursuit of happiness. Okay? You can't have life and you can't have pursuit of happiness if you don't have access to health care. Okay? It's kind of important. Okay? Cut out the programs all over the place. The government shouldn't be paying in. Okay? Stop throwing all this money overseas. But the government has to have oversight and some control in the healthcare business. Oh, and one last thing before I stop. Insurance premiums will never go down until the cost for medical care goes down. You see, claims come in, billed by the medical providers, then the insurance companies will negotiate on the bills, and then they pay. The higher the bills, the higher the insurance companies pay. The higher the insurance companies have to pay, the higher the premiums. So until something is done that gets some type of control over actual healthcare costs, we're always going to see the premiums that we're seeing. Okay, so that pretty much covers everything that I was looking to cover on this video, which I'm almost at 14 minutes, so hopefully you're all still listening. Again, if you think that I'm wrong about the Medicare system and you think it's bad for everybody, don't just give me the standard regurgitated crap. Give me the actual reasons why, and I guarantee you not one of you will come up with a good one. But you know what? Right down here below, I'm looking forward to it. Have a good day.